special issue of JSCAI on CCTA.
Thank you so much, and thank you for the opportunity to share with you how was this special issue in cardiac CT. And I decided this picture for the introduction because it felt this way. It felt like a networking across so many specialties, so many people, so many reviewers, and it was really, it felt like an adventure with a very strong networking and support. So thanks for the opportunity to share with you how we built this special issue. I had no disclosure. So why a special issue in cardiac CT? And I think JSCAI was at the top, knowing that this field was just growing so much in our specialty, and felt this was a great opportunity. And cardiac CT has emerged like as a first-line test for diagnosing, treating, evaluating prognosis in different cardiac diseases, and we really needed to get in there. Provides not only anatomic but functional, not only cardiac but also non-cardiac information, and is a very powerful non-invasive test that help us in the indications in different clinical scenarios and help us making decisions not only clinically, planning PCI, planning structural procedures, and now also helping cardiac surgery to plan their interventions. So I'm going to go over what you can do with cardiac CT, and then you will think how challenging it was to plan this special issue itself. So when you think about cardiac CT, with this test, we not only have the opportunity to rule out completely coronary artery disease, we also diagnose subclinical atherosclerosis, and we have the opportunity for prevention of events. We diagnose significant CAD. We plan interventions, and we also do follow-up for the interventions. So when we were planning this, looking at all of these options for cardiac CT, it was very challenging to understand how many people we needed involved. Diagnosis of CAD, this test has really taken over many, like this field, completely in diagnosis. You have the opportunity to tell a patient you don't have CAD, your calcium score is 0, you don't need prevention for this. You also have the opportunity to say you have atherosclerosis, it's non-obstructive, you have to be on statins, or you have obstructive disease and you have to go to the cath lab. But now we have so many options with cardiac CT to assess functional, to assess the myocardial mass, to assess plaque morphology and calcium burden. And not only this, but I'm going to go over all of these diagnostic indications of cardiac CT. You can assess bypass patency. You can assess patients with endocarditis, and we had a beautiful paper in this special issue how cardiac CT is now the test to diagnose endocarditis, the support of diagnosis in cardiac masses, anomalous coronary artery disease, in this case the RCA is arising for the left coronary cuffs, also leaflet thrombosis, and the support in TAVR, mitral interventions, tricuspid interventions, and also vasculature. So just reviewing these, when Alexandra had the idea of this special issue, let's write a special issue in cardiac CT, you wonder how many people, how many specialties, how many fields do we need to get involved to do a decent review on cardiac CT. So when we came together, it's like, how are we going to do this? How many people do we need? How many people we need to invite? How open we need to be, not just for coronary, but structural, but congenital, but prevention, but artificial intelligence incorporated to this, and was a real journey to understand how we were going to plan this. And this is the beauty of this, and I think JSCAI allowed us to do anything we needed to support a special issue that really contributed to our field. So I think this was a perfect design that constitute like equity, diversity, and inclusion in a full spectrum. So JSCAI and Alexandra were very supportive when we came to plan this. It's like, how many people do we need to do this? And I think as cardiologists and interventional cardiologists, we had to recognize that cardiac CT was not our field, was not our testing. This was started by radiology, and they have done amazing contributions. So in the first place, we decided to be not just cardiology, but radiology planning this. And then when we plan what type of people do we invite to write this, we invited radiologists, cardiologists, cardiac surgeons, pediatricians, infection disease specialties, like any type of specialty that felt they could contribute to this field. We also decided to be open to many fields in these tests, not just coronary, but structural, congenital, innovation, artificial intelligence, any special software that is incorporated to this, and the infectious disease paper that is one of my favorites in the special issue about endocarditis diagnosis. In equity, we send special invitations to people that were involved in research, future research that were working on important manuscripts, and also we did an open invitation to anyone that felt they could contribute to this. So it was a real journey in the preparation. The most important is when we were thinking about how broad we wanted to be with this special issue and how impactful we wanted to be, we felt, okay, how much do we have to do with this? How is our timeline? We built this in 4 months, literally. We started working in August, and in December was our deadline. And when we think about the time we had to plan this, we really came out like with friends, networking, people that we were working in the past to get this done. And thanks to the previous presentation, that was a beautiful presentation, I wanted like, what is the fellowship, editorial fellowship role in this special issue? I think the fellows come not just from JSCAI, but from the blue sky, and they are always rescuing, supporting, like they did an amazing job. And then for the papers, we invited expert reviewers and people in the field, but we always invited a fellow to support these reviews, and we were very impressed by the quality of the reviews. And I had to say, doing this myself, that the reviews that the fellows did for this special issue had a very high quality, many times even better than expert reviewers. So we got to work together as a team, and we got this in 4 months, and we came out with this special issue that we feel very proud of. It had papers in coronary plaque morphology, FFRCT, artificial intelligence, TAVR, mitral interventions, endocarditis, and a bunch of important fields in cardiac CT. So you're here thinking, well, I don't know, I didn't know all of this can be diagnosed with CT. You're thinking you're late. I will say that yes, I think you're late, you don't know MASH and all of these indications. But honestly, this special issue that we work together to publish is a beautiful representation of what you need to know, at least in this field. So I think saying thank you for the opportunity to JSCAI for allowing us to work on this. And I agree with Alexandra. I think this is a journal, like, thanks for creating this journal for us. And it has unique participation opportunities and really is the equity, diversity, and inclusion that we were allowed to work on this special issue. For being open to new ideas, new projects, for creating like a real networking around science. The people we got to be related to work in this issue was a very special opportunity. For delivering high-impact science that supports innovation, education, and training, and mostly for having an amazing team that is there with you and for you when you're working on this. So if anyone gets the opportunity to work on this, say yes. Even if the deadline is 3 months, it's 4 months, they will help you to get it done. Like, thank you so much.
Well, you know, I didn't tell Natalia what to say, but thank you very much. That was great. I really appreciate it. I think you're right. We did that special issue in record time, and it came out. It was absolutely beautiful.